Hi, everyone, and welcome to Compassionate Conversations, a video series created by Home Care and Hospice and Total Senior Care to educate and support our community through short, meaningful discussions. In each episode, we'll connect with members of our team and other trusted voices to share knowledge, experiences, and insights, all in a relaxed and approachable way. Today on Compassionate Conversations, we're honored to be joined by Dr. Gilbert Witte, who has served as Medical Director for Home Care and Hospice for more than 30 years. With decades of experience in end-of-life care, Dr. Witte brings a deep well of knowledge, compassion, and perspective to the conversation. He'll reflect on what he's learned from walking alongside patients and family, how hospice care has evolved, and why this work continues to be so meaningful to him and to our entire team.
Well, I think when a patient or a family member is dealing with an illness and it is reaching in the terminal phases of the illness, so that it looks like the options for care are really being exhausted, then it's time for the family member and the physician or caregiver to think about a hospice referral. It's we provide care. We think of providing care to patients to cure them of disease and to treat symptoms of disease, and really we're always doing both at the same time. The what we call palliative care is something everybody deserves to get, treatment of symptoms of pain and other symptoms at the same time as we're attempting to treat them and cure them of their illness. There comes a time when the chance of curing of their illness is not there anymore, and that is sometimes not clear, or it's difficult to recognize and also difficult to accept. But when the patient himself is expressing, things aren't working, I am tired of this, and they're suffering with uh, the illness that they have, it's clear to the caregiver or the physician that the options for treatment have become much more limited. It's really time to think about that. Uh, Hopefully sooner than when the patient is actually at death's door, because we feel the patient can benefit from hospice earlier, uh, much more than if you wait until the very last minute. And of course, that's often the difficult part, is for not just the patient, but the family and the physician, of recognizing and accepting that it is time to think about hospice care, time to realize that the chance of curing the disease is no longer there, and we want to focus on quality of life for the amount of time that a person has left. When hospice comes on at the very end, you can provide relief of symptoms of dying, pain, and other bodily symptoms. You can try to interact with the family and help them do what they need to do at that time and to get through it. But if you could come on earlier, and we do say in hospice that we look for people who have 6 months or less to live, as determined by the people providing care for the patient. If the earlier in that time we have the patient in hospice, the more good we can do them, because then we really have time to work with the family to get them ready, to help them through the process. And plus, with the patient, we can get them on regimens of treatment for pain, for nausea, for other symptoms, for also, of course, for dealing with the psychological traumas that are there. The more time we have, the better job we can do. In coming onto hospice, there is always going to be an element of giving up, because you're accepting that you can't cure the disease. A patient with a cancer, uh, the oncologist always tries to give them hope. You always have treatment, one treatment or another, but there comes a time when there is nothing available. And then there are other diseases, chronic diseases like heart disease and COPD, neurologic diseases like strokes and Parkinson's disease, where at some point the burden of disease is just too great, and the person, it becomes clear, is not going to get better. So to that extent, there is a giving up. But what hospice tries to do is say, we're going to help you into this next phase, this last phase of your life, where we're going to help you get the most out of it that you can. Our goal is to improve the quality of life in patients who have hospice, and the quality of caregiving for their family, so that we try to make it the best possible experience that we can for them. Well, I think of course, I've been a provider for many years as a pulmonologist and an internist, and you want to treat your patients to get them better. And just as it's hard for the patient to accept, I'm not going to get better, It's hard for the physicians to realize that this is all they have left to offer. We as caregivers are not very comfortable in having that conversation. We always want to give words of encouragement to the patient. Oh, we're going to try this. And it's hard to accept that at some point you have to say, we've done the best we can. This is all that we can do. We need to focus on treating your symptoms now and having you get the best out of your life. We can't fix this anymore. But that's tough. It's tough for a doctor to, that's not how we're trained. It used to be, 100 years ago, that's mostly what doctors did, was provide comfort. But as we developed all these wonderful tools of medications and technology to extend life and cure disease, that became the focus. And, very appropriately, when it can be, treat and cure disease. That's what we do. But we have to remember the other part is still an important part of what we do, provide comfort. And that at some point, that will become the primary thing, the best thing you can do for the patient. I think I would want people to know that hospice is about quality of life. It's about the best quality of life for the patient and for the family, providing help. Hospice is not about putting people to sleep at the end of their life. It's not about what you do when you're about to die. Hospice is about giving you the best kind of life that you can have for as long as you can have it.